Hey, it's Ryan Reynolds, and I'm here with Keith, co-star of my upcoming film, If, only in theaters May 17th. Do you want to tell people the big news? All right, I'll do it. Sign up now and you'll get unlimited for $15 a month and 6 months of Paramount Plus Essential Plan on us. MintMobile.com/switch.
Upfront payment of $45 equivalent to $15 per month. Unlimited over 40 gigabytes per month. Face lower speeds. Videos at 480p. Active Mint customers by 531.24 get 6 months of Paramount Plus Essential Plan. Auto renews after 6 months. Offer ends May 31st, 2024. Separate Paramount Plus registration required. Terms and conditions apply if rated PG.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steyer, a public health scientist, and today I'm joined by a very special guest, my amazing husband, Dr. Ethan Chapin, an emergency physician and medical director of urgent care and occupational health. All right, today we're going to talk about the emergency room versus urgent care. The clock is ticking, so let's get to it. All right, Ethan. So what are some of the key differences between an emergency room and an urgent care center?
Key differences are going to be resources and training. So urgent care is somewhere where you should go if it's something that you could see yourself going to your primary care office for. If it's something that you would see your primary care doctor for, but you just can't get the appointment, or you need to be seen a day sooner than they have an availability, that's an urgent care visit. If it's something where you feel like you need blood work or advanced imaging, or you are truly worried about how sick you are, how injured you are, that's an emergency department visit. Keep in mind, urgent cares are not emergency room light. Urgent cares are really more of an unscheduled primary care office.
Mm-hmm. Now, I just want to tell everyone that Ethan tells me all the time that this is such a gray area. There's no set criteria. ERs and urgent cares vary depending on where you are. There could be totally different facilities, right? So you can have one facility that maybe has more equipment than other facilities. So it's very difficult to make these sweeping statements. So with that in mind, typically, what types of diagnostic tools and equipment are available in an ER that you probably wouldn't find in an urgent care?
It might be easier to look at the urgent care first. So urgent care is going to have a provider who can do a physical exam. You're going to be able to get vital signs, check a blood sugar. Sometimes they will have access to X-ray, more often than not, but it's not universal. Occasionally ultrasound, and there are urgent cares that are just underneath the equivalent of a freestanding emergency department. So they might have CT scan, but really expect a bare minimum when you go to an urgent care. Emergency departments are going to have everything. In order to qualify as a true emergency department through CMS and the states, you're going to have everything you would need to diagnose life-threatening injuries and illness, and all of the resources you would need to keep someone alive if you're heading the wrong direction.
So are there certain examples, maybe some specific illnesses or injuries that stand out to you as an automatic trip to the ER versus urgent care?
Absolutely. So if you have hit your head, lost consciousness, very unlikely that is appropriate for the urgent care. In fact, they will almost universally turn you away. If you're having stroke symptoms, if you're having respiratory distress, if you're having any kind of major vital sign abnormality that you've already diagnosed at home, for example, your heart rate is racing over 100. If your blood pressure is very high or very low, if there's a car accident you've been in and there's a rollover or someone ejected or the fire department had to help to get you out, that's not appropriate for the urgent care. And again, any type of abdominal pain, severe abdominal pain, especially with fever, you're probably going to get turned away from that urgent care and sent to the emergency department.
So are there any age-related factors? So for parents, maybe, infants, is there a certain, age-related factor that might influence the decision to go to the ER versus urgent care?
Absolutely. Most urgent cares, and it's going to depend on the training of the provider and the scope of that particular center, but under 2 years old, if there's anything more than a runny nose or a minor rash or a mild cough, they're probably going to be turning you away. Again, the training is what's key here, and also the lack of access to resources if there was something more serious. So urgent care providers may have that training, whether from family practice residency or pediatricians or having the emergency department experience. But overall, in children under 2, if there's something that you feel couldn't wait for the pediatrician the next day, you probably want to go to the ER.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
From the terrifying power of tornadoes to sizzling summer temperatures, AccuWeather Daily brings you the top trending weather-related story of the day, 7 days a week. You can learn a lot in just a few minutes with stories about impending hurricanes, winter storms, or even what not to miss in the night sky. So listen and subscribe to AccuWeather Daily wherever you get your podcasts. That's AccuWeather Daily wherever you get your podcasts.